Good evening, everyone. We're just going to give it one more moment. I can see that folks are still signing in, so we'll give it about another minute. Okay, we are right at 6 o'clock, so we can go ahead and get started. Good evening, everyone, and thank you so much for joining us. My name is Carrie Ann Viens, and I'm the Associate Director of Graduate Admissions here at Bay Path University. And before we get started, I just kind of wanted to give a couple of housekeeping items. So just please note that this session is being recorded. So if you miss a portion or want to share it with a friend or colleague, this link will come into your inbox tomorrow morning once it becomes available. And this is my information here. Let's see, and Holly.
Hi everyone, my name's Holly. I am the program assistant for the Master of Public Health program at Bay Path. And we are also joined by the MPH graduate assistant, Nazia. I'll let her introduce herself.
Hi everyone, my name is Nazia Ashraful, and I am the MPH graduate assistant for this calendar year. And I'm also a first-year doctorate of health sciences student in the public health track at Bay Path University. So excited to be with you all today. And I'm very excited to introduce our speaker today. So our hot topic tonight is an overview of the Massachusetts Department of Public Health Occupational Health Surveillance Program. And our special guest is Angela Laramie, is that correct?
Mm-hmm.
Great. So a little bit about our presenter. So Angela Laramie has spent her career in the occupational health and safety field, including more than 20 years at the Massachusetts Department of Public Health as an epidemiologist working on healthcare worker health and safety. She has obtained her BMPH from BU and has been an active member of the American Public Health Association. Before we dive in, just want to make sure that folks know that they can utilize the chat function within this GoToWebinar system so that you can put in any questions, any thoughts that may come to mind during the presentation. And then, you know, after the presentation is over, we can definitely dive into those questions, thoughts, and delve a bit more about what Angela is going to be speaking to us about today. Without further ado, I'm happy to present Angela.
Great, thank you so much for that warm welcome. I'm really pleased to be here with you all tonight to talk about occupational health surveillance and the work that we do at the health department. I think that you'll find that there are some things that I'll share with you that you'll encounter in your role if you end up being a clinician, but also as a worker, some things that will pertain to you. So we are seated within the health department, within the Bureau of Community Health and Prevention, and we're a unique program in that we do surveillance of work-related injuries, and we also do prevention of work-related injuries. So we really do both sides, this data to action. On the next slide, you'll see we've been looking at work in Massachusetts. We've been considering it for more than a century and a half. You can see from this list of death certificates from 1875, we've been capturing occupations. And so you can see the various cultivators of the earth, laborers, professional men, merchants and financiers. So we've really been looking at the distribution of fatalities and diseases by occupation in Massachusetts for a long time. On the next slide, we'll talk about why is it that we would consider occupational health. Well, we have more than 6,000 deaths annually across the country. 6 out of 100 workers are injured on the job, and there's more than 862,000 people who end up with illnesses from the work that they do. We estimate that the costs related to work related injuries and illnesses exceed $142 billion. That's both medical, lost wages. So if you get injured on the job, you're entitled to workers' compensation, and so that will reimburse you for your lost wages. And then there's the lost productivity, and that cost is borne by the employers. Employers also have a legal obligation to provide workplaces that are safe. OSHA is the agency that's responsible for ensuring that for private sector. And in Massachusetts, the Department of Labor Standards is responsible for public sector workers like myself who work in government at the state and municipal level. We also know that there are occupational health disparities. We know that workers of color and immigrant workers are at higher risk of injury or illness because they are often exploited on the job. They are not provided with required personal protective equipment, required training. Training needs to be provided in a language that's easily understandable by the workers and in a culturally sensitive manner. We also look at surveillance research, and so there's a bunch of different ways that you can capture data, different ways to look at it, and so that's part of what we do within the Occupational Health Surveillance Program. The next slide shows you some of the data that we look at. I mentioned that we look at fatalities. In Massachusetts, we are one of, I think, fewer than 10 states across the country that track fatal work-related injuries and illnesses. And you can see the pattern over time. This is just since 2000. We've been collecting data since the 90s. But you can see the blue bars are the number of fatalities in a year in Massachusetts, and then there's the rate as the number of deaths per 100,000 workers. And you can see there were some dips through the pandemic, and there was a little bit of a spike. We've seen changes over time that correspond to economic changes. We had some lulls in construction with building, then we had some booms, and you can see that fatalities follow these patterns. And that is done under our Fatality Assessment Control Evaluation Program, as well as our Census for Fatal Occupational Injuries. And with the Fatality Assessment Control Evaluation Program, we go out and we investigate workplace fatalities, and we look to see what are the factors that led up to those fatal incidents, and how can we share information that will prevent future injuries from happening. In the next slide, we're going to talk about the social determinants of health. This is probably a phrase that's familiar to many of you. And you can see that we look at violence, we look at the built environment, education, employment, the social environment, and housing as all social determinants of health. Some people consider them to be social drivers. You may also see different factors that are included in a model about social determinants of health. And this happens to be what the Department of Public Health uses. If you look at the CDC, their model looks slightly different. And you see that employment is included as a social determinant of health. And many times people look at this as a question of, are you employed, yes or no? But it's not enough to be employed. And so we'll talk more about the role of the social determinants of health on the next slide, and why, or what the role is that work plays in health. And so, thank you. You can see that employment is good for health in general. In Massachusetts, employers are required to provide, or I should say, we're required to have health insurance, and oftentimes that is provided through your employers. Your workplace provides some psychosocial support. It also provides some income. But it's also the type and quality of work that matters. We want to make sure that people are working in environments where they're not exposed to toxic chemicals, where they're not exposed to extreme temperature changes, dangerous equipment, heavy lifting, or violence. And then there are the organizational factors like shift work or long hours. And then this high demand, low control, there's a model, it's known as Karasic's model, and people who have a lot of demand placed on them but don't have a lot of control over the work that they do and the way they do it, ends up creating some psychosocial impacts in a negative way. We also know that the burden of occupational risks is not borne equally. I mentioned this earlier. We know that low-wage workers, many immigrant workers and workers of color, are disproportionately employed in physically demanding, high-risk and high-stress jobs. And again, the employer has a responsibility to provide a workplace that is safe and free from hazards. On the next slide, I'd like to talk about some definitions. I mentioned that we collect data, and one of the components that we look at is occupation. So I want to just clarify that occupation is the kind of work that a person does for a living. It's your job title. The other thing that we also look at is the industry. And so that's about the employer and what kind of work is the employer engaged in. And so you can see some examples here where it's important to distinguish by industry. So we can look at secretaries and administrative assistants as an occupation group, but they may have different exposures depending on the industry in which they work. So we see one example with social assistance, air transportation, oil and gas extraction, sporting goods, other retail, and then state government. And what's not on here is maybe somebody works in a factory. You might have a small machine shop and somebody is a secretary or administrative assistant. They might be exposed to high volumes of noise or poor air quality that's coming from the machine shop floor, because perhaps that's where their desk is situated. So it's really important to know the environment in which they're working, and we're best able to do that by looking at what the industry is of the employer. On the next slide, I'll just share with you some information about state occupational public health programs. There are about 24 or 26 states that have a funded occupational health surveillance program similar to the one in Massachusetts. We're funded by the National Institute of Occupational Safety and Health, which is part of the Centers for Disease Control and Prevention. And while I won't read this to you, you can see that really our mission is to gather data so that we can promote the health, safety, and well-being of people in Massachusetts. And we do this in a variety of ways, from collecting and providing data, and with that includes the responsibility to give data back to those people who provide it to us. We'll talk a little bit about that later. We do investigations. I mentioned that our fatalities project goes out and looks at work sites. We try and mobilize partners because we're a small group. We're about 10 staff who are, trying to think, we're all full-time, epidemiologists, industrial hygienists, health communication professionals. We rely on our partners, so we provide data to them. One of our partners is the Massachusetts Coalition for Occupational Safety and Health. They work directly with workers and worker centers. We might also partner with labor organizations. We also try and impact policy, regulations, and legislation. We've had some luck in the past with child labor laws based on data that we've collected in Massachusetts. And then I'll show you a case study where we were able to impact some things that an employer was doing based on the data we collected. And we provide technical assistance. We'll go out to hospitals, or I go out to hospitals and talk to them about Sharps injury, surveillance and prevention, but then also trying to integrate work as a social determinant of health into mainstream public health. So the way I like to think about it is over the course of one's lifetime, almost everybody works. And so work really does play a crucial role in our overall health. On the next slide, I'll share with you the goals of occupational health surveillance. We want to find out how big of a problem do we have? How can we measure what's happening so that we can measure our progress in eliminating those hazards? We work to identify high-risk industries, occupations, and worker populations, as well as the workplaces where interventions are needed. And then we also look to identify patterns in the injuries that we're looking at. I'll talk to you later about needle stick injuries, which is where I've spent the last 23 years working I keep saying I'm going to work myself out of a job. It hasn't happened yet. But we also want to increase awareness among the general population, among employers, and among workers about hazards and then ways to prevent injuries from happening. The next slide I'll share with you shows some of the projects that we're doing. I mentioned fatalities. We also collect data on work-related respiratory diseases. If you diagnose somebody with work-related asthma, you're required to report that information to the health department, and that comes to us. We do work with healthcare workers. I mentioned the Sharps injuries, and then also we've been looking at what work-related factors there might be around suicides. And we have just finished some work on opioid use. Then we have a program that all of the states who are funded to do this work have. It's called our Fundamental Project, where we look at emerging issues, but we also look at some other issues like lead surveillance. We do surveillance of work-related injuries among teenagers. And that's another injury that's, if you're treating a child, a teenager who's been injured at work, then that should be reported to the health department as well. I'll share with you on the next slide some of the data sources that we use. We do two kinds of surveillance. We conduct population-based surveillance, where we're using large data sets like workers' compensation data to track various trends over time. It doesn't require any access to personal identifiers, and it's not always the systems that we use are not always designed to capture work-related injuries and illnesses. Certainly the workers' compensation data is, but we also use data from the Bureau of Labor Statistics. And trying to think, I've now drawn a blank, but there are other administrative data sets that we also use. But then we also do case-based surveillance. I mentioned the work-related lung disease surveillance that we do and work-related asthma cases that get reported to us. So that's an example of case-based surveillance. And so we get reports of those illnesses, and then we follow up with the individual cases. And in that case, we do have personal identifiers because we're able to make contact with the individual and ask them about the circumstances where they work, what they might have been exposed to, that kind of thing. We hope that the case-based surveillance, that those cases end up being able to be identified in our population-based surveillance, but sometimes that doesn't happen. So it's optimal to use both kinds of surveillance data. So I'll talk to you a little bit now on the next slide about the project that I've spent most of my career working on, and that's Sharps injuries among hospital workers. Any of you who might be studying to be a clinician or work in an environment where care is provided, probably aware of this hazard. And it's one that's faced by many, many healthcare workers. And with this injury comes the risk of transmission of disease, namely hepatitis C, hepatitis B, not so much now that most people are vaccinated, but also HIV. There's more than 20 other diseases that are transmitted through needle stick exposures. We recently have dealt with Mpox, and that's another one of those diseases. In Massachusetts and nationally, healthcare organizations are required to provide workers with devices that have Sharps injury prevention features. And that's part of the OSHA bloodborne pathogen standard. In Massachusetts, it's part of the hospital licensure regulations. Also required by both of those sets of regulations is the record keeping. So every employer under OSHA, and in Massachusetts, every hospital has to keep a Sharps log that identifies the circumstances surrounding each exposure incident, and that data gets sent to us. And for those of you on the next slide who aren't familiar with the devices with Sharps injury prevention features, I just wanted to share some examples of that. You can see one is a two-handed sliding sheath, retractable. You may be familiar with seeing the hinged arm snap down feature. The next slide just is an example of our data over time. It's pulled from the most recent data brief that we published for the 2020 data. And you can see that over time, the rate of Sharps injuries has come down for the first 7 or 8 years, and then it's remained relatively steady over time. I can tell you that most injuries occur among nurses. Most injuries occur in the operating room, and they involve suture needles and hypodermic needles and syringes most often. And while we have a requirement to use devices with Sharps injury prevention features, there are some cases where those devices aren't utilized, and the older style traditional devices are used. And so we have 40% of our injuries occur with devices that lack these Sharps injury prevention features. I'd say most of those are suture needles. And so I take that data and I look to see what are the patterns, and then I can go into hospitals and say, what are you doing in your operating room to provide either additional training? Are you doing hands-free passing, so using neutral zones, that kind of thing, and see where in the process of delivering care might we change the approach so that we can prevent injuries from happening, starting with buying the right devices. So the next slide talks about using data for action. I mentioned that one of the requirements, if you will, for surveillance is to give data back to the people who provide it, but also to use data to identify prevention measures and strategies. And so we use our data to prioritize intervention and prevention measures. I mentioned with Sharps injuries, we have some hospitals that have over 100 needle stick injuries. And so to try and figure out where do I focus my efforts right now, we can use that data to prioritize those intervention methods. We also want to evaluate how well are intervention efforts working. And then we might identify potential risk factors and generate hypotheses for further research. We've had in Massachusetts a fatality in the last couple of years in the cannabis growing and manufacture industry. And so that's really an emerging hazard. And so we look at what are the risk factors in that industry and how can we focus research in the future. And then also raising public awareness and influencing policymakers. One example that you'll see on the next slide for data to action is with our young worker injury surveillance project. So we collect data about injuries to anybody under the age of 18, and we found years ago that a number of young workers were working at a local donut establishment, and they were getting 2nd and 3rd degree burns. And when we called these workers and asked them more about the work they were doing, they were pulling out the brew baskets, and the slurry from the brew basket was splashing out and covering their hand. And they were doing this to check and see if the coffee had finished running through. And in the process of putting the brew basket back in, that's when they were getting burned. And so we went to the corporate offices and shared what we found, and they worked with the maker of the coffee machine, who then rolled out a way to retrofit an interlock so that you couldn't pull the brew baskets out before the coffee was done. And then they eventually redesigned their entire coffee maker so that there's an interlock and it won't let you pull it out. And so corporate rolled this out across their franchises and gave some time to franchise owners to replace this. But we saw a decrease in the number of injuries that were happening from this hazard. So we look at that as a success. Another thing that we've looked at is opioids and work. And we have looked at death certificate data to identify individuals who have passed from opioid-related overdose deaths And then we looked at that information by various demographics, including industry and occupation. And we identified that some industries like construction, we saw individuals who worked in construction had higher rates of fatal overdoses than other industries. And so we've started to work with other organizations to help address this. And sorry, I'm looking ahead. One of the things I should mention is that one of the pathways to opioid overdose is if somebody has a work-related injury and they are treated for the pain, and then they're trying to work through the pain and rather than being able to take, maybe they don't have time to take, or for whatever reason opt not to go through the workers' compensation system, then they feel this pressure to go to work and show up. And so we look at this as one of the ways to prevent this from happening, is to prevent the initial work-related injury to begin with. And on the next slide, you'll see some of the impact evaluation that we've done. There's a program that's about opioid alternative treatment pathways. And so we've worked with some other organizations, and they're trying to evaluate how well this program is working. And one of the things that we're looking at are recovery supportive workplaces. And those aim to prevent exposure to workplace factors that could cause or perpetuate substance use disorder, while also lowering the barriers to seeking care, receiving care, and maintaining recovery. And we find that a recovery supportive workplace educates the management team and workers on issues surrounding substance use disorder to reduce the all too common stigma around this challenge. And while the evaluation that we conducted was specific to the Massachusetts context, the documents that I described earlier can inform and inspire other states and federal initiatives to reduce the toll of opioid-related harms in injured worker populations. I've mentioned that OSHA, on the next slide, is responsible for worker health and safety. And you can see that there are employer responsibilities. I've mentioned a couple of times already that the employers are required to provide a safe and healthful work environment free from recognized hazards. And then there are workers' rights. And so as a worker, you can complain to OSHA about your workplace conditions. And you can see there's a number of ways that you can do that. And then we have what's known as whistleblower protection. So you can complain to OSHA and be protected. So you can't be fired for raising an issue about workplace health and safety. OSHA also does surveillance of work-related injuries. There's another log that employers are required to keep of all of their work-related injuries, not just the needle stick injuries that I mentioned earlier. And that information gets submitted by some employers to OSHA at the end of the year. And so our data in Massachusetts really works in concert with that, and it enhances or fills a gap in available information about specific work-related health outcomes and hazards. And I think, in your role as workers and perhaps as employers, I think it's important to be aware of OSHA regulations, both in terms of the responsibilities of workers and as rights, your responsibilities as employers and your rights as workers. So in conclusion, on the next slide, I just want to reiterate that we see work as a significant social determinant of health. It's important to capture information about work in any surveillance data that you might be doing. At the health department, outside of our program, we have broader injury surveillance data. There's a cancer registry, and that certainly captures information about work. Birth certificates capture information about the occupations of parents. And in Massachusetts, OHSP tracks these work-related injuries and illnesses, and as I mentioned, we try and offer strategies for prevention. There are many work-related conditions that are reportable to the health department. Some of them happen through an electronic lab reporting process, like blood lead levels get reported to us. I mentioned that we do lead surveillance under our fundamental occupational health surveillance project. And things like work-related lung disease and work-related asthma, as well as young workers. There are some heavy metal poisonings. Again, those are lab reported. I'm sorry that I'm blanking on the rest of the list, but it's a long list. If there's a cluster of work-related illnesses that you see that as a provider, then that would get reported to us at the health department as well. And we really see that data to action is the key component to occupational health surveillance. We don't collect the data just for data's sake. It does no good if it's just sitting, on my computer or on my desk. It's really important to get the data out to the people who can use it, both to protect themselves as workers and then also in their role as employers to protect the people that they're working with. And that concludes my presentation. There's various ways that you can connect with the Department of Public Health. And then if you have any questions, the last slide has my email address and also has the website for the Occupational Health Surveillance Program. I'd be happy to entertain any questions.
Absolutely. Thank you so much, Angela, for sharing your expertise.
Sure.
And as she said, does anyone have any other questions or comments that they'd like to share about the presentation or programs? I'll give you a moment to go ahead and enter your questions into the chat if there are any. We always welcome your feedback and questions.
And I will also add, while people are thinking about any questions, we work with students. And so I realize that BayPath is out in Western Mass, but I'm sure that, there might be some way that we could, if you've like applied learning experience requirements or other interests in occupational health, we're always happy to see if there's a way that we can work together with students.
Let's see. Okay, the first question coming through is, what inspired you to pursue a career in occupational health?
Oh, wow. That's kind of a long answer, but I'll give the abbreviated version. I learned at a very young age because of the work that my mother was doing as a legal assistant. She was working on asbestos cases in the 70s. I learned at a young age that people went to work and came home sick. And this notion that like that shouldn't be. And as I went to college and thought I was going to end up figuring out how to make a better widget in some factory, I realized that all of those principles about quality could be applied to worker health and safety. And so really decided that that's where I wanted to be, and ended up working for a workers' comp in risk management. And that's where I really decided that there were a lot of people who were looking at factories and construction safety, but I hadn't run into a lot of people who were looking at healthcare worker health and safety. And so that's where I've really focused my career. I feel like we need to take care of those who take care of us when we're, in times of need, and that really, I, in my experience, I feel like healthcare workers do such hard work that isn't always recognized. And and the injuries that are faced every day are often sort of accepted as it's just part of doing the job. And I, every time, even as a patient, I remind my providers, like, it's not just an accepted, it shouldn't be an accepted part of the job. So that kind of grew up around talking about worker health and safety issues, I guess.
Great, thank you. The next question I'm seeing is, can you tell us more about the challenges you face in promoting employee health and safety?
Sure. I think one is, as I mentioned, that some people look at the risks that they face on the job as it's just part of the job. And I think trying to convince people that they don't have to endure the hazards that they're facing, you know, that there is a safer way or other methods or personal protective equipment that's available to protect them. I think, I think just, you know, getting the word out at sometimes it can be challenging to convince employers. And I think that there's a lot of things that they're trying to juggle. And so trying to make sure that we frame it in a way that says, this is good for your business, this is good for your workers, in addition to being a regulatory requirement.
Great. And the last question I'm seeing come through is, what advice would you give someone considering a career in occupational health?
Oh, wow. I think there's all kinds of amazing books that are stories of, you know, of people and the work that they do. And so I think reading about different, and I'll be happy to send you all a list of books, but reading about people and the work that they do, I think learning about the regulatory requirements, taking a look at what OSHA does, taking a look at what NIOSH does, talking to people who might work in worker health and safety is a great way to learn about it. There's some really great programs at different universities around Massachusetts. I think, and the other thing I think that's, I don't know, this is my perspective, but there's a population, like healthcare workers are my people. Like, that's who I feel really drawn to take care of. And so I feel like know what excites you. Like, is there a population? Is there a group of workers, or is there an industry that really interests you? Or is there a particular hazard that, you know, you don't ever want to see anybody get hurt falling on the job, and so fall protection becomes like your thing that you become an expert at. I don't know. I think expose yourself to all kinds of things. There's some books. I have the Radium Dial Girls. I'm forgetting the name of it. There's another one called Fresh Fruit, Broken Bodies, which is about migrant farm workers. Read about Frances Perkins. She was the first Secretary of Labor.
Great. Well, thank you so much, Angela, and for answering all of your wonderful questions and for your presentation this evening. This is how to get in touch with us. This is our contact information. And again, this will be coming to your inbox shortly. But we want to thank Angela and each and every one of you for joining us this evening. And we will be sharing the recording and presentation slides with you in a few days. But thanks so much for joining us this evening, and we hope to see you at future events. Have a great night. Thank you.